Hi, this is Dr. Tom, and I'm coming again to talk a little bit about the HCG diet. And again, I have some topics that have come across my desk. One is that after a phase 3 lock-in, some patients report feeling depressed when introducing carbs back into their diet, particularly the simple carbs. Although complex carbs have the same reaction for some, is there any correlation between depression and lack of energy carbs in the diet? Well, some of these complaints of depression haven't come from the patients within my office. Most of the complaints of depression are things that we're hearing online. And again, it's a question of who is talking about this depression. If people have done different programs where they're not doing the 4 phases, they're not doing the cleansing and the detoxification phase, they're not completely following the diet the way they're supposed to in phase 2 and can still lose weight using HCG regardless of this, however, not following the phase 3 diet the way that we do in the office, is that HCG and depression are not correlated whatsoever. So the use of HCG and the HCG diet in and of itself has nothing to do with depression. If people experience depression in phase 3, it can be any number of things. One is, yes, it can be related to bringing carbohydrates back into the diet. Extremely rare that it would be complex carbohydrates in the form of vegetables and most fruits, unless, of course, you're eating a large amount of fruits and simple sugars. But it all comes down to insulin. If you are eating that way and taking large amounts of carbohydrates, especially simple carbohydrates in, and you abnormally raise your insulin levels, especially eating in the second half of the day, then you can become hypoglycemic. And anyone who has been hypoglycemic sees the fatigue, the depression, and as well as irritability and possible anxiety, the need for a nap, the feeling of not feeling well at all. Yes, this can be. Chances are the people who are complaining of the depression in phase 3 are not properly introducing the carbohydrates and are introducing and depending on too many carbohydrates in their diet. Second of all, in phase 3, if you're not following the diet properly, if you do not have the proper coaching and the proper follow-up and doing the program properly, you can gain that 3 pounds very quickly. Now, sometimes people have a lot of anxiety over their weight and losing their weight, and already on antidepressants, mainly because of their lack of gaining weight, their lack of being social, lack of exercise, all those type of things that they had their depression in the first place. If they rapidly start gaining weight back in phase 3 because they're not completely following the diet as far as simple carbohydrates go, that can be a cause for some people having depression. But the one thing that I will say with much confidence is the diet in and of itself has nothing to do with inducing depression.